see what we get. Is this on? Yeah, okay. So this is a big topic. So what I really wanted to do is boil down some of the important features, give you a little bit of reference in literature, what's going on, to be helpful and sometimes hurtful. I do have a disclosure slide. We do a lot of research at Dartmouth and won't get any personal compensation for that, and have participated in some advisory boards. As I said, just want to highlight some navigation skills within the healthcare system, some self-care highlights, and then I have some templates which I think some of you got on entry, which I hope are helpful for you and your providers for navigating the system. I'm echoing what Dr. Weeks had started with, and that migraine is a neurological disorder, and I really think it's important that we put that forward, that it's not a psychiatric disorder, that it's not just the headache. And so that's usually where I start with my patient interactions. This is really a disorder. It's common. We've given you the statistics, and it's disabling. But I see more when I see my patients in front of me. You are human beings. You feel invisible at times, I think. There's a lot of power sitting in front of me that wants to get better, want to interact with people, want to be part of society, want to be part of school, want to go back to college. So how do we make that happen and make the migraines and the headaches background noise the best that we can? And I feel like you guys know your bodies, and I think that's really important as you interact with providers, to let us know that and have us listen to that. I think that the healthcare relationship is a partnership, and I think the biggest takeaway points, I see a lot of teenagers in my practice, and I love seeing the growth of having mom and teenager or father and teenager sitting in my office and switching seats because the teenager doesn't want to sit close to me at first, taking the history from the patient and making sure that I'm paying attention to the patient, and then watching them grow and understand the healthcare system. I think that's one of our roles. And so for kind of that navigating the high school time frame and college, it's not only figuring out why do you have migraines, and sometimes we don't have a satisfying answer for that, but developing that partnership with your provider and figuring out how to best communicate with your providers is really important, and that's what I want to see when I'm seeing you guys in my clinic. Really putting that patient-centered relationship. So things for good communication that I wanted to highlight. When calling a provider's office, I really encourage that the patient is on the phone. So my 16-year-old patients, if a mother calls and the patient is available, we ask for the patient to tell us, because no one else is in your head, unfortunately. You're gonna do the best job communicating with us. And so really making sure that we're giving you the opportunity to express yourself and tell us what's going on. Be prepared and know what medications and what treatments you've tried. This is a hard thing to do. This is navigating the healthcare system. We have 3 names for our drugs, at least 2, sometimes 3 names for the different medications that are prescribed. Do you understand the indication? And I spend a lot of time in my clinic doing education, and I find it very helpful with our new health apps on the phones. Enter the information, get to know what you're taking and why. And then also understanding if there's side effects so that that can be communicated with your provider. What else do I have on here? Say something. So this is the other piece, especially with my younger patients. I want to know if I'm talking over you, if I presumed that you knew something and you don't. I want people to be comfortable and go, Dr. Nye, I don't get it. My mother, when I used to come back from medical school, really excited about something, who's a nurse, would say, talk to me like I'm a human. and so I have that runs through my head occasionally as I get excited about something, but I want to make sure that we as providers are communicating well with our patients. And it's okay, I would say, to any of you, to ask your provider to explain something again that you didn't understand, that medical term just didn't make sense. You know, can you tell it to me in a different way? So you've got to come out of there with that understanding and gaining the knowledge. You want the explanation. I think that's still relevant, like Dr. Weeks had pointed out. And then again, asking that question, not just about an explanation, but if something doesn't align with your thoughts on therapy, I want to know. I can't tell you. I have the benefit of my nurse is a patient of mine, but so are her children. And so I get feedback occasionally when I have the children in my office, and she comes back and she says, well, they don't want to do that. And I said, why didn't they say anything? Like, I asked, I tried. So I do think it's very powerful to make sure that you say, you know, that I don't understand, or that doesn't really work with what I want to do. I don't want to take that kind of medication for X reason. I need to know that. I need to see if there's something different I can offer, or if unfortunately that is the offer I can make. Sometimes we've got our hands tied, unfortunately, but nothing is going to work if you don't take it, if you don't use it, if you're not prepared to engage. And so it's really important for a provider to know that. And so I really encourage folks to feel like they have a voice in the clinic. For providers, I don't know that I have many providers in here, right? Do I? Do I have any providers? Besides the ones up here? The ones on our panel. So from a provider perspective, I think it's important that when we're asking all of these patients these great questions, that we read the triage note, that we take the time to do that. Review medications tried. I think that's a pitfall that providers have, that sometimes we don't have ready access to medications tried, so we may make a suggestion we've made before that was either tried and failed, or tried and didn't get any benefit. So having a reviewed document is important. And then having an action plan, kind of in the background, so that when folks do call, that we say, yeah, well, we talked about that IV infusion, that might be an option, or maybe you can come in for that procedure. I might not have the time to do it, but my nurse practitioner can certainly do it, but we have a plan in place. So kind of thinking 2 or 3 steps ahead. The IV infusions either in the center or having an ER plan is also important. And I actually have a draft of a note for that coming up. So what can we do for ourselves? Self-care, adequate sleep, and making sure we get those 8 to 10 hours, and addressing if we're not. I think sometimes sleep gets at the bottom of our questions, because when folks come back to the headache clinic, we want to know about your headache days and how the medications are doing. But I do like to try to reel in on sleep and figure out if we have some obstructive sleep apnea. Do we need to go see a sleep specialist? Do we need to readdress what we're doing in bed? For teenagers, unfortunately, there's usually a bedroom that has the desk, that has the TV, that has the devices, and reorienting maybe that bedroom being just for sleep, and taking the desk out of the bedroom, and taking screen time and minimizing it an hour before bed can be really helpful in things that we don't initially think about. But so addressing sleep on a regular basis. Anxiety and depression, we were just talking about this. I'm not going to go back into it, but it has a role. It needs to be addressed, and so if it's not being addressed, it needs to be brought up, and we do need to address it. Good hydration, avoiding triggers. So this is a long list of triggers over there. Good hydration, there's different recommendations. The ones that my nurses usually use is half your body weight in ounces is about right. Getting at least that seems to be adequate. Listen to your body though, in the end. You don't want to over hydrate either. And so when you're not thirsty, you don't need to continue to chug water, but also be mindful that you should probably be sipping on something most of the day. So having it available, I think most of us are carrying around our water bottles these days. Good culture change. Again, looking at the headache consortium guidelines kind of for the meditation, mindfulness, engaging the cognitive behavior therapy that Dr. Weeks has told you guys about. This takes a time commitment. You know, you have to practice, and sometimes doing this in groups is really beneficial, but there is a commitment there. And then once you learn how to do it, there's a smaller time commitment, but you have to keep practicing and you have to continue to engage in those activities and take your 5 or 10 minutes a day. So documentation for doctors. I think I've got this all out of sorts, I apologize. That one slid up. So the American Headache Foundation has some great documents. Are you guys all familiar with this website? No? Okay. They've got some excellent resources that are nicely vetted, and so I pulled up a couple of their slips, so accommodations for kids in school and some educational tools that they have that you can easily print out. School attendance is really important. We do find that you're still learning something even if you're not at 100%, and so engaging in the activity of actually attending school is really important. So the first thing, if I have students that are not in school at all, is to actually get them on campus for part of the day, but we really want students to be engaged the entire day. If you're getting headaches first thing in the morning and it takes an extra hour or two to get up and get moving and make sure that that headache is quieted down that you have first thing in the morning. Sometimes we make accommodations with the school to make sure that like you have study period first thing or something like that, but we work with the schools. And I've got some more things on IEP plans. If you get a headache or a migraine that develops during the course of the day, having a nurse that is well prepared, knows what you're taking daily, knows what's available, and we work with the schools often to make sure access is easy to medications, especially in high school because most students can't carry their medications with them, and we all know you raise your hand, it takes 5 to 10 minutes for a teacher to notice, and then there might be a discussion, then you're sent to the nurse's office, another 5 to 10 minute walk. You're already 20 or 30 minutes into a migraine escalating before you even get to hold your medication, right? And when all of us doctors say, treat it as soon as you get it, right? And so we're already putting our students at a disadvantage, and so educating the faculty at the schools and the nurses to have this readily available. Some students will lay down for a few minutes, make sure the medication can take effect, but I do encourage that the students go back to school and re-engage. And I just pushed something. Okay. We do engage in individualized education plans or IEP plans. Are you guys familiar with this? Mm-hmm. Yeah, good. I'm always glad when people have at least heard of them because sometimes I think it's a resource that is under educated about. We can make testing and attendance, as I said, recommendations, and they're often taken to heart. Sometimes people have to meet with a guidance counselor, but often they do it from your doctor. And I've given you guys some templates that you can bring to your doctors if they're not doing this routinely. Allowing the access to meds we talked about. And then the tinted glasses. I do see some of you with your rose-colored glasses to filter out that blue light. And I think that can be very helpful, and it's not, I know when I was going to school, everyone wants to see your eyeballs. And so sometimes those darker lenses are a little disruptive when you're looking for respect from a student. And so you can see through the red tinted glasses, and that's often pretty acceptable for folks. The American Academy of Pediatrics did recommend that high school and middle school should start no earlier than 8:30 a.m. because our sleep cycles change as we get older, and the initiation of sleep gets bumped almost till about 11 p.m. in teenagers. So it's completely normal that they stay up or you stay up late and then want to sleep in a little bit, but society has structured it so that high school students have to be in school at 7:30, and you still need that one additional sleep to reset, to rest, and to help with your headaches as well. And so unfortunately, only 18% of schools nationally are in compliance with this. It has much larger implications. It's busing schedules, it's high school football games. It's got an impact, but I think we need to start seriously looking at it. So this is something you can take back to your schools and school boards and start talking about if it hasn't been brought before them. The school nurse, they are wonderful partners. We need to educate our school nurses. We have good relationships with many of our school nurses, and sometimes it's the first time they've heard from a headache doctor, but we often provide them with educational materials, getting to know the medications that are being prescribed to our headache and migraine patients, and then having that availability to just quickly treat patients and not to give them ibuprofen and Tylenol every time they come into the office, to make sure they're avoiding medication overuse headache, because they usually have some basic tools at their disposal but haven't always heard about migraine and medication overuse headache. So we do have notes for them as well that I gave you templates for, but we often do engage them and make sure we know what's going on. Pregnancy, so I'm gonna put a little word in. 40 to 70% of pregnancies are still unplanned. And as we're talking about high school and college, I think we need to be paying attention to this, not just because the headaches themselves change with that, with being pregnant, but really it's the medications that we're giving as providers to our patients. I think it's really important to start having this conversation, because a lot of our medications have side effects and are teratogenic to a fetus, and so we would like to do more family planning, I think, and it's something I actually address in my first and almost every appointment. I never want to discourage anyone from family planning or having a baby, but I'd like to be involved in that to help you make medication decisions, because often we're getting notified that you've been on your Topamax and then someone gets pregnant and we're already 4 or 5 weeks down the line and the damage is probably done. So we do want to kind of encourage folks to start thinking about, should they be on birth control? Have you tried a bunch of different things? Engaging in an additional conversation, and do we need to send you to another specialist? College considerations, housing, classing timeframes, class timeframes. I have written many notes for folks that are going into college just so that they can have their own dorm room, because 20-minute nap will resolve the headache or get you functional again. And if you have a roommate, unfortunately, you don't know what's going on, how much perfume they're putting on, any number of triggers. And so this is pretty easy to do. Most colleges have each have different applications to look at. Some are very simple, some are a little bit more complicated, but making some time with your provider to go through these documents, I think, is really important to advocate for having the best college experience possible if you are in the dorm setting. Class timing, again, if you can't get out of bed in the morning and your clock is still set forward, making sure you're not scheduling yourself for 8 a.m. classes, that we're setting you up for success. Alcohol consumption can lead to triggering headaches, also interacts with medications, but there's a lot of pressure for that. So having those conversations early, having an action plan for what will you do when someone asks you to go to a party? What are your alternatives so that you don't feel like you have to say no to going to the party, but holding a container in your hand that you know what's in it, those kind of things. But making an action plan for that, thinking about it before. Working with local providers, so this is difficult. Access to a headache specialist, as we discussed, is limited, and so I really encourage folks to have contact with a local provider that we can partner with, because you may not be able to come home for your headache specialist more than once or twice a year, but having someone that can help us manage your headaches and prescribe if needed. This is a ER survival guide. This is also for the American Headache Foundation. So having the ER might be needed when you're in college, but having an action plan for that as well. This is the template that we use. I really say, no narcotics. If you have a problem, call us. We will help triage, and we often have a plan of medications. So it's not just don't do something, but here's the plan. And so that's set out in front. I have the school nurse note and the IEP plan letter, and that's all I've got.